other topic in relation to the fundamental ethical principle is very important in the field of the COVID. But this principle may be different definition and interpretation in different traditional and faiths in different countries. But the adaptation of this topic to the culturally oriented national approach is very important in the ethical consideration in this field. There are in Iran, we have an Iranian Supreme National Bioethics Council, and this have three bodies: Committee of Research Ethics, Committee of Educational Ethics, and Committee of the Healthcare Service Ethics. And this shadow of this arrangement or this system you can find in all of the universities of the country. You know, in Iran, we have nearly 60 universities in medical school, in medical science. And this group have coverage in the some population of his country, of this state. It means at least all of the state of the country have one university, have responsible for education, research, and health services in field of the ethics, in field of the medicine. And this is this shadow of the system of the national bioethics you can find in different universities. In the justice, it is very important we avoiding discrimination and exploitation of the considering vulnerable group. And it also includes procedural justice, which refer to fair process of the importance decision-making as transparency, accountability, and monitoring. And definition of interpretation of the justice may be different in different countries, but it is very important that we try to adopt the culturally oriented multidisciplinary approach to the management of the COVID-19. Respect to the individual is important because the recognition of the common humanity, dignity, and human right, and the respecting human dignity is of great importance in our culture, and it also included respect to the autonomy, which require leading to the individual makes their own choice based on their value and preference. Transparency, truth-telling, and it is very important because the context of this, the public health and research activity may be follow in these issues. The practical consideration, the application of ethical principle in scientific evidence and about the action expected in benefits and harm is very important. Benefit and harm is very important in our culture, and this restriction on human right must be based on the law and the purposes of the benefit of the society. And it means some limitation of the this issue maybe must be followed by some committee of the country for this, because this is very important for the population trust to the response to the COVID-19 pandemic. The other issue is all persons who could potentially be affected should be opportunity to contribute to the management of the disease, and maybe some of the committee may be involved to the two-way dialogue for the management of the disease. The vulnerable group is very important. The poverty group, homeless group, illiteracy group, it is very important for the management of considering poor and deprived people in very important in our culture. Unfortunately, we have a big challenge for this issue, because before of the COVID, we expanded the health services in all of the state, and the limitation is very, very low. And closure to a school and the other issue is very important for the violence relation to the elderly and children. The face masks, shields, and the other things expanded to all of the country with equity and is the regulation. This should be achieved through maximizing benefits and minimizing harm to this group. Healthcare professional should be in priority in this receiving limitation, because this group is in the protective and personal protective equipment for the management of other group people. In Iran Islamic culture, resources should not be allocated, as to the sex, gender, and age. It is some of the main principle we accepted in the medical ethics. Disclosure of the personal information is very important. If they have a several risk, it is very important to follow up this issue. And this is very important. We should be aware about the information engaged for this issue. Restriction of the freedom of movement in Iran was based on the best available evidence. And this is usually in the same times access to food, drinks, and water, and different issue managed by the other groups. One of the issue is the research relation to the COVID-19. Fortunately, all of the research be done in the university, followed by the ethical review very fast, because all of this is electronic and may be implemented in all of the university, and from the Ministry of Health, followed by a team, and Dr. Shamsi is one of the team who manage the research of all of the university, and we have designing a fast-tracked evaluation of all of the research done for the COVID-19. This is very important. We tried the rapid review and accelerated the process of the registration of the clinical trial. I think many clinical trials this time is run with the different university of the country. And before 48 hours, usually the rapid review response to the people scientists who wanted to register. We have many projects, and this project run by all of the human project is evaluated in the RESC committee. And this is very important. In the committee, we register all of the clinical trial, and 17 medical university try to different projects for the COVID-19. And this is very important. We protected the individual from the unproved intervention. And we haven't permission in all of the hospital for the unproved intervention for the management of the patient. There is some evidence regarding efficacy and safety. Ethical committee must be followed, and informed consent must be obtained, and monitoring of this group and the inform of the research project must be sending to the team for follow-up of this. And the biological specimen collected for the patient, the access to the information is important and not be transferred to outside of the country without permission. And this is another regulation we run in the Committee of the Ethics. The healthcare personnel of this inform of the risk of the involvement, and the health workers who become infected may be best quality of care and supported. And not only this group, the family of this group may be supported for the problem of the COVID-19. And the case of the healthcare worker, this closely family should be really supported by the short or long-term support. I hope if following the guideline in relation to the COVID-19, some of this idea for the implementation for the long-term within the country. The foreign governments and external humanities aids, it is very important after agreement of the local government, maybe should be sent to the health worker, and the foreign aid workers should be sent only if the capacity of the local limited. And this is very important. The aid workers must be provided with training, preparation, and the equipment of this issue. This is some guideline, the guideline of the management of the ethical issue in infectious disease. This guideline we involve to the follow-up. The aspect in this guideline is related, can be related, may be related to the COVID-19. In conclusion, I think the COVID-19 situation is very important for health issue. And in the same time, it's very important for the ethical group. and the ethical, maybe some exam of the ethical group for the management of the ethical health delivery to the population. And I hope we, with the hope of our friend in Indonesia, can expand the ethical challenge in this field and maybe designing some international guideline relation to this problem of the whole of the population of the whole of the world. Thank you for your attention.
Yeah, thank you, Professor Larinjani. Again, this is a very excellent and very interesting talk. And during your talks, I received more than 5 questions already. But we will collect all the questions until the next speaker is finished with the lecture. Then the next speaker is we call him Romo Kusmarianto. He is one of the staff in the Center for Bioethics and Medical Humanities. Actually, he is the first bioethician, formal bioethicians in Indonesia. And also he teaches in the Sanata Dharma University in Yogyakarta also, other than in Universitas Gadjah Mada. So for the next speaker, Romokus, please.
Thank you, Dr. Azib. It is a privilege for me to share with you about special situation in Indonesia. If Professor Larinjani already shared with all of us so many ethical problems in Iran, but in this situation, I just want to share with you about only one thing, which is confidentiality in the time of the pandemic outbreak of COVID-19 in Indonesia. Why it is, I will present it because it is very interesting during this pandemic outbreak of the COVID-19 about confidentiality. We know that COVID-19 is believed to have been originated in Wuhan, China. And the first case of the novel coronavirus can be traced back to November 17, 2019. And it is only on December 27, China realized that the disease was caused by a new coronavirus. And on January, it is on a month after, the WHO declared the coronavirus a global emergency. And then from Wuhan, coronavirus spread all over the world. Within a few days, the cases were confirmed in India, in Philippines, Russia, Spain, Sweden, and many other countries. And we know that the first outside death outside the China was in the Philippines on February 2020. From early January 2020, many Indonesians were very anxious about COVID-19 because they read in the social media that COVID-19 spread to many countries and that their thought changed rapidly. Meanwhile, in Indonesia, government claimed that Indonesia didn't have the case. It is a problem. And many Indonesians question government's pronouncement in every very anxious to know the truth. Finally, only on March 2, after 2 months of uncertainty, Indonesian President Joko Widodo announced the first case of COVID on March 2, 2020. And this announcement was followed by great curiosity to know who, why, where, and how it happens. And after this, less than 24 hours later, it came up the real name of the person, their address, even the photos of the house in the social medias. On the one hand, many people upset because of disclosing the patient confidentiality, but the other hand, many people demand the disclosing the identity of the patient. The above disclosure of the patient confidentiality become a vivid discussion among many people, both pros and cons. The discussion is getting intense when the first two patients express their anger and discomfort in open press conference because they received negative label from the society. Two patients said that they received messages from their cell phone condemning them for improper attitude. So that's why they get COVID, because they had improper attitude. You know that some Indonesian regard that in the beginning that COVID-19 is God punishment because of sin or improper attitudes, so that people are ashamed in suffering of the COVID-19. Those discussion on the preaching of the confidentiality is not only a matter of healthcare, but also it is private moral. We know that one of the oldest medical ethic principle is duty to protect patient confidentiality. And protection of patient confidentiality can be found also in the Indonesian legal system. By law, patient identity, medical record, health information must be kept safe and private by doctor and other healthcare professionals and all healthcare facilities, such as hospital and clinics. It means that in Indonesia, the protection of patient confidentiality is a heavy obligation because it is not only ethical, but also it is a legal duties. So, why we have to protect patient confidentiality? First of all, it is all about the common good. Protecting patient confidentiality is a form of promoting common good, especially for the benefit of the patient in the society. We live among so many different people in which we cannot look evil of others and expose it publicly because it will damage common good. It will damage human relation in the society. Without knowing other evil, many people live in serenity, in peace. Keeping confidentiality is form of respect and love to our neighbor. The second reason why we have to protect confidentiality. Everyone has the right of privacy and confidentiality because under natural condition, the inner mind of a person with what you think and what you desire cannot be read and understood by other people. It will remain secret for other people and until it is revealed. It is in the power of the owner whether to reveal or not to reveal. It is in the power of the owner. It means that there is always something which is secret and confidential and cannot be exposed externally except by the consent of the owner. The third reason is about respecting human dignity. The patient has the dignity as an autonomous human being. As an autonomous subject, patient has the right to decide whether his personal information should be kept or disclosed. Those who receive the information, medical professional, medical doctor, and a nurse, etc., have to respect patient ways to keep information safe and private. The fourth reason, it is in healthcare, protecting patient confidentiality is very important because it is prerequisite of the trust, which become the foundation of the doctor-patient relationship. Without trust, the therapeutic process between patient and doctor will be ruined and even will end up in a conflict. And a patient will not come again in the doctors. Disclosing patient confidentiality need serious reason. So the next question is, it is an absolute to protect the patient confidentiality. It is widely acknowledged that the duty to protect patient confidentiality is not an absolute. Tom Bishop and James Childress, he said that protecting confidentiality information is part of the respect for autonomy, in which autonomous choice of the patient must be respected by medical professional. In order to make good autonomous choice, doctor give necessary information and patient gives some personal and sensitive information which he believes the doctor will keep in secret. Bishop and Childress said, not only do we hold that the principle of respect for autonomy lack priority over the other principle, but we maintain that it is not exclusively individualistic to the neglect of the social nature of the individual. And he continues that the principle of respect for autonomy in each of these rules has only prima facie standing in combating moral consideration sometimes override them. It means that if something which is more serious than protecting patient confidentiality, somebody or someone can open it because there is something which is more important than the patient confidentiality. Protecting patient confidentiality is only prima facie because sometimes there is nothing which is more important. So the duty to protect patient confidentiality is not an absolute and can be loosened under the certain condition. What is the certain condition is? If protecting patient confidentiality endangers the public health or potentially harm innocent other, the protection of patient confidentiality can be override by the duty of the beneficent. So, we know that the value of human life is another reason for disclosing the patient confidentiality. The value of confidentiality in the value of human being cannot be compared because the value of human being is very, very, very high. It is the foundation of all the ethical principles. The value of human life certainly surpasses the value of confidentiality, even it has the highest values among other things. And especially for the medical doctor, it means it is the medical doctor's duty to keep the human being. We cannot sacrifice the highest value for the sake of the lower value. If protecting patient confidentiality threatens human life, we have to sacrifice confidentiality in order to save life of a human being. So for this argument, I will make an argument about this. In the Indonesian context of COVID outbreak, disclosing patient confidentiality can be justified based on some indication. First of all, in the beginning, COVID is a new disease that we don't know exactly how to prevent, how to cure, because there is no available vaccine. There are also many pathological uncertainties. We still need to learn and to research more to know exactly what COVID is. Secondly, COVID is highly and easily transmitted disease through the droplet or an air. Although the percentage of death is relatively low in comparison with other respiratory diseases like SARS, MERS, swine flu, etc., the cases are very high, so that the number of mortality is also high. It is contagious and deadly disease which frighten anybody. It needs extra precaution and prevention in order to stop further spreading. In this case, I want to mention two real cases in Indonesia. Why I said something like this. There was a quarantine patient who escaped and returned back to his kampong. There he played football together with other young people and prayed in a worship house, etc. He never said that he had COVID. And when local authority realized that he had COVID and with rapid test, he found that all the young people in this kampong were also infected by the COVID because of this patient. The patient is not aware of the consequence of telling the truth, because he was ashamed and embarrassed. The consequence is clear. He endangered public health and harmed innocent people. The other case is the opposite. It is medical professor of a university in Indonesia. He was hospitalized because of COVID. From this hospital, he announced voluntarily that he had a COVID. Before he was hospitalized, the professor contacted many people couple days before, and he did not remember all the contacts. He hoped that people may trace and track the possibility of the infection because of contacting him. And because of this disclosure, finally, there are some people who were infected in their contact with the professor. In this way, the professor saved many lives. So what is the justification for disclosing the confidentiality? From the two cases, we learned that exposing public health and harming innocent people are enough reason to disclose the patient confidentiality, because the value of human being is much more higher than the confidentiality. If protecting patient confidentiality will harm the well-being or bonum commune, it is exactly contrary to the general aim of protecting patient confidentiality, so it is an obligation to breach confidentiality. As stated above, Bishop and Childers said that primacy of the protecting patient confidentiality is only prima facie or prima facie standing, and a specific situation can be overridden by the principle of beneficence. Certainly, there has to be a balance between promoting a public health and the duty to minimize deviation from the norm of respecting patient confidentiality. It must be there is a balance between cost and benefit. The cost is that patients lost their privacy and confidentiality, and the benefit is the protecting of bonum commune, endanger public health, or potentially harm the innocent people. It doesn't mean that patient confidentiality has to be disclosed to all the people nationwide, but it has to be disclosed only for those potentially will be in danger by protecting patient confidentiality. Thank you very much, and have a good discussion after this.
Thank you, Romo Kusmarianto. Yes, I have chosen several questions that address to specific speakers. The first question is from Indonesian participants to Professor Larinjani concerning the scarce resources that you already have also in Iran due to the COVID pandemic. So how scarce resources is allocated? Is it first come, first serve, or how the Iranian physicians manage the pandemic in their hospitals? Can you hear me, Prof. Larinjani? Can you hear me, Prof?
You hear me?
Still muted.
I think this is very important topic.
Cannot hear.
For the management. No, all the here. Yes. I think this is an important topic and have some fortunately is maybe bed for the patient for the emergency, and we have some bed for some state, maybe 20 occupied situation. Hospital we use the for the hated of this group. Some of this serve the group city for designing a model of the services. This is the big need because
Excuse me, Prof. We cannot hear you clear enough. So I will ask some participants to ask on their own. So I would like to invite Dr. Rima, Dr. Emiarti. Dr. Rima, we will open your mic and please you can ask questions to both of the participants.
Okay. Can you hear me? Hello?
Yes, clearly.
Okay. Thank you for this opportunity. It was very interesting presentation from all of you, especially from Iran, that have the same religion with us. Yeah, mostly in Muslim. Yeah, in Iran. I just want to ask you now how you all of the researchers can influence the government's policy, especially concerned about how they make a role to with the mosque, like sometimes they are in our regions, in Indonesia, some obey with that, but some not obey with that, because they prove that there is a mosque besides the market, and it's free of COVID, because there's some proof that sometimes people doesn't agree with the condemn of praying in the mosque. That's my first questions. And my second question is how support from also from the government or from whatever Department of Health to the residents who work hard in the hospital. And as you know, the amount of the students is who have a confirmed positive, it's getting higher now in Indonesia and some parts of Indonesia. So how is what in Iran? How you treat the residents and the junior clerkship or whatever students who work in the hospital during the pandemic? Thank you.
Yes, Professor Larinjani, please. There are two questions about the support about the religions aspects, and also the second question is about the physicians in training. How you can in Iranian and how you manage them now.
We
We
suggest shows
you to turn off your video so that maybe the
started
sound is better. Yes.
Of the COVID-19 management, who to support of the who involved in the management of patient university, and usually try to support of this group, but this time we try to embed this issue in the guideline of the COVID-19 for recommendation of the support regulation for the student get permission for coming to the ward is limited and separated to different groups, because usually not crowded in the some cases of the student, and it means, for example, non-student is separated to 3 groups. For example, outpatient and something similar to this issue.
Okay. Thank you, Professor Larinjani, for the answer. The next question is from Dr. Shinan Shukur. We invite Dr. Shinan Shukur to ask to the speakers. Dr. Shinan. Dr. Shinan, are you hearing us? Okay, while waiting, we invite other questions from the Dr.
Yes,
Shinan?
hello.
Okay.
Hello.
Yes, Dr. Shinan.
Hi, how are you?
Fine, thank you.
Thank you for this nice presentation. I have maybe 2 questions regarding the disclosure of COVID infected patient names. So we have 2 views. Is the transmission of infection when we know the names, as China has applied this policy and they have many apps for that. But from ethical view, or we may have psychological trauma, the stigma of the disease. So I'd like to ask the ethical view, how can moderate between these 2 views? from ethical view? It is better to disclose or no? The other question is the...
Between disclosing and
No, sorry. In other way, when we disclose the name of COVID patient, we will have the benefit of avoid transmission, and we will know the contact of that patient. However, this may cause psychological trauma, or because the COVID infected patient usually stigma in our society, Middle East, Iran, and Indonesia also, as I think. So what's the ethical view? How can we avoid this? Is there any facility or view from a presenter to avoid stigma and as well to avoid infection transmission? The second question regarding Iran is an Islamic country. However, there are many other cultures. So when we have Islamic rule may obligate some seculars, what do you think? How can we apply these, such as opening the shrine of Imam Reza will may increase the transmission or infection rate, which is obligated and objected by secular. So what do we need? I think, what do you think? My opinion, we need for human ethics rather than just Islamic ethics. Thank you. Am I clear for the second one?
yeah. So
Thank you very much.
yeah, Prof. Larinjani.
I think you have two questions. One of them is my friend from Indonesia can explain better than me about the ethical view for disclose of the information in relation to the patient. I think I mentioned is very. I think this disclose, not disclose, affected from this. And I think this is very important. We support public engagement from the to think to each other. Of them this of the patient to the other people. The other is to affect public. We must justify this both to. I think is the education, because many of the ethical guidelines, some public education relation to this. If we have some good education for the public, it's not a stigma. It is maybe a relation, and it is many people. Other relation to the limitation for the mask and some other things, I think the regulation from the ministers is not based on the Islamic viewpoint. It is evidence from the health issue, some evidence about how we can manage. In the same times, for example, some mask is open, similar to some size open. Some meeting may be open at the same times. The regulation is come out from the evidence medicine, from the documentation of the evidence in relation to this. But the important issue in Iran is acceptance from the who engage in region or clergymen with the people in the health issue. And this acceptance is very, very important things for the encouraging of the management and acceptance of the people. This is in relation to the recommendation of the Ministry of Health is accepted by the Islamic group and by the secular group. We have many secular groups in the idea, maybe in the practice, maybe some secular groups, but in the the extent of the Islamic viewpoint, maybe other than 90% of the parties accepted this from the theoretical. Thank you.
So for the next, Romakos will answer the questions, the first question of Dr. Sinan. So Romakos, please.
Okay, thank you. By the time our president announced the first cases in Indonesia, actually our president didn't mention about who is the name, etc. It's only they said that we have cases to cases. But what happened in the society is that the society looking for who is suffering, and then within 24 hours, it's come out on the who is the name, it is the address, and also even the photo of the houses. So now it's become the debate about confidentiality. Should we break the confidentiality or not? And from my point of view is there is only one possibility in which we can disclose the patient confidentiality if it is endanger public health and for the innocence, it is the innocent people, it will be affected for not disclosing this. So otherwise it should be kept secret. Confidentiality in such a way that because it is confidentiality is very important, whether it is in the health system or in the society. So the only thing in which we can disclose the confidentiality of the patient is only in which by closing the confidentiality, there is a danger for people will be infected by this coronavirus. So only in this case. So now, after a couple of months of the virus, it's mean that now we getting better understanding of the situation of the getting better about the virus. Maybe there is no more such situation in which we have to open the confidentiality. So once again, I just want to say that there is one possibility in which we have to open the confidentiality, tell the people he or she suffer from COVID if by refusing to open the bonum communi or common good will be in danger. Okay, thank you very much.
Okay, thank you, Romakos Marianto. So please join me to thanks to the two excellent speakers and for other participants who already posed the questions in chats or in WhatsApp groups. We will collect all the questions and then we will send to the speakers to have their response. Hopefully you don't stop asking questions in chats or in WhatsApp group because your questions will be the next themes for our international forums. So due to the limited time, I would not draw any conclusions because these two speakers is too excellent to draw conclusions from. But we will try to keep the issues hot enough for us to talk more about medical ethics and COVID-19. So hopefully you can join us in our next sessions. And time to Ibu Puspa.
Thank you, Dr. Azid. That was such an inspiring session. Now we'll proceed to the next half of the discussion session, and this time it's entitled Religion's Contributions in the Pandemic Era. The speakers for the session are Professor Syafa'atun Al-Mirzana and Professor Mohsen Javadi. The session will be moderated by Ibu Erlina, PhD. Bu Erlin, I will hand over the session to you. Thank you.
Thank you, Mbak Puspa. Thank you. Thank you. Good afternoon, everyone, and welcome back to the second session of this webinar. I would like to introduce the actually two distinguished speakers and also reintroduce again the topic for the session. So we have here Professor Safaatun Al-Mirzana. She's a professor in religious and Islamic studies and holding a PhD in the theology. We know that she's a well-known speaker, both in national and international. She's instructor in various schools like Graduate School of International Program, teaching religions and global issues, and also religions and bioethics. She's the writer of the incredible books, titles From Mecca to Las Vegas. Yeah, and then the second speaker, we have Professor Mohsen Javadi. He's a professor at the Department of Philosophy. His research interest is in the ethics philosophy, philosophy of religions, and also Islamic philosophy. So without further ado, I will pass over this to Professor Javadi first, and you have 20 minutes for this presentation, and then followed by Professor Safaatun, and then also after that we will open the floor for discussion. Okay, please, Professor Javadi first, I think, or Professor Safa. Oh, sorry, Professor Safa. Professor Safa.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Because I
wabarakatuh.
could not unmute by myself, so I wait for the committee. Okay, can I share my screen, please? Okay, this is what I want to, want to share with you in this time. My title will be Restoring Our Faith in Action Communities Pasca COVID-19. This is the outline. Oh, sorry. Okay. First, I would like to say about religious communities' response to COVID-19, and then challenges and what we learned from COVID-19 actually, and the role of faith for COVID-19 also. And this is a kind like a guidance how we to remain healthy physically and also spiritually. And then the last but not least, we will talk about health literacy and what could be done for this. So now, how actually religion, or how we a Muslim community and also Indonesian community as a whole responded to the COVID-19. COVID-19 actually has put many religious communities at the crossroad. So on the one hand, the health sector has strongly promoted what some call social distancing or physical distancing in order to prevent the spread of the disease, for example, by lockdown declaration by the government. But on the other hand, this directive have left several implications in all aspects of life. I think you already mentioned about that before, including the closure of social, economic, political, and religious gathering in most countries. So what does this mean? We can see how social necessity has disrupted religion. So then I think most of the question also already mentioned about this. There is a kind of like debate about religious liberty in the one hand, and in the other hand, communal responses. So one area of strong resistance from religious institutions is that cultural changes forced upon them due to social distancing, for example, which embody the move toward mediated or disembodied worship, They said it is not just annoying to them, but they said it is against their religious freedom. So they say restriction on religious gatherings soon become framed by a religious group as an issue of religious freedom. So they said, so no, this is about religious freedom. Why should you say, why it is not possible to go to the mosque, for example? Why it is not possible to go to the church? It is our freedom. That's actually the response. I don't think that when Professor Rarijani mentioned that, this is actually my question in the chat, how actually Iran also respond to this, because it seemed like in Professor Rarijani's presentation, most of them are agree with that. So it's almost like there is no resistance for that. But here in Indonesia, I think there are a lot, including my brother himself also. Why do you say that? We have ibadah in our mosque. Why it is impossible to go there? So that's kind of stuff. So this is the issue of religious freedom according to them. Besides that, actually in Islamic tradition, we already have that kind of response if we have a pandemic. So for example, Islamic tradition instruct that in a moment of plague, the most important step for a believer is to take is seeking refuge in Allah in the time of pandemic. So there is a certain hadith, the Prophet ﷺ said, "Oh Allah, I seek refuge in you from leprosy, madness, communicable disease, and evil sickness." So I think that's what we have to do from religious perspective. Even though sickness in Islamic view sometimes considered as a blessing, because when someone is suffering in pain, that's mean pain turned to be a cleaning of one's sin. Some tradition mention about that. For example, in Sunan Abi Dawud, even Muhammad himself could attest to the blessing brought by sickness. That's also in Sahih Bukhari. But Muhammad could still instruct believer to avoid pestilence by all means. So I think this is the important thing, is that even though it is a blessing, but still Muhammad instruct believer to avoid pestilence by all means. So self-quarantine, for example, and containment as one of the strategies to hold the spread of pandemic. So there is a hadith also, it is said, do not mix the sick with the healthy. So this means actually also social distancing. It was further reported by Abdurrahman ibn Auf that I heard Messenger of Allah say, if you hear that a plague is in a land, do not go there. So I think this is what our government have done so far. Tidak ada mudik, there is no mudik. And if it is break out in a land where you are, do not leave. So fleeing from it, we cannot come, we cannot also go. So I think this is a kind of instruction for self-quarantine actually. No, with all of that, because right now I think we are coming what we call a new normal. So I think this is a challenge for our future religion. Because now it is impossible, it's almost impossible to go back to the first before there was a COVID-19. So I think we need to redefine what it means to be a religious community and how to practice our faith in the midst of sickness that strive on physical contact and proximity. So this means that for most of the people, community is something that is dynamic and changeable, hold multiple connection, and is determined by personal need and choices. So the idea of network challenges most of religious group understanding and practice of community. So that's depend on, I mean, it is a dynamic, and changeable interpretation, what it means by religious community. And now what actually we can learn from COVID-19? Because right now we cannot go to the area of worship, for example. So it is that digital form of religion may be more accessible to people. Why I said this? Because there is a certain information that even when the church or the mosque are open, some people when come into that places, they feel uncomfortable maybe because there are discrimination. But it seemed like the digital form more accessible for them. So it seemed like the eliminating the physical space of church or mosque may be a sacrifice, but to others, maybe it is an invitation that cannot be accepted otherwise. So on the deeper level, the current situation actually allows us to reconsider the meaning of sacred space and how spaces that feel uplifting to one person maybe can be threatening to another. This doesn't mean that we should do away with the brick and mortar, but rather that we have a unique opportunity to examine our assumption about where people want to be when they interact with the holy. So I think this is what people said. This has been a factor of COVID, even though we have a guest, unwanted guest, but there is a certain benefactor that we have to criticize what we have done, what we understand about our region. So in the normal life, COVID-19 actually has introduced a new normal life in many aspects. Even the pandemic had led Muslim scholars, ulama, to revisit the Sharia and Islamic ruling on different aspects of their belief. For example, here I give you one example on about salat and burial for the people who are infected by the COVID-19. In this new normal, which has affected religious rite and how we pray and bury the loved one, might be give implication like emotional implication for the affected, but I think this is what we have to do in this new normal life. This is why I think a Muslim scholar have to rethink about the Sharia, Islamic ruling, about this kind of practices. And now what actually the role of faith, because we are talking about the role of faith in this kind of pandemic. Before talking about that, I would like to say a little bit about fear and immune system. According to the research, the very emotion we are all now experiencing actually increase our susceptibility to the dread virus. Why? Because of the adverse effect of the immune functioning that fear, anxiety, and psychological distress cause. This is according to research. But at the same time, positive emotion have the exact opposite effect on the immune system as do fear and anxiety. So I think this is what the faith can do. This is the role of the faith. I think in every tradition, here I quote from John, for example, like the fruit of the spirit, like love, joy, peace, kindness, that kind of stuff that is considered to be case out of fear. In Islamic tradition, we have a lot of these, and also in Jewish tradition, I just skip this, and Buddhist and Hinduism tradition. In the research shown that Hindu-based meditation reduce anxiety and increase positive emotion, as does Hindu-based yoga practices. So there are many, kind of spiritual practices that actually can increase positive emotion and decrease or reduce anxiety. This is important for this kind of situation in the COVID-19 pandemic. And all of this actually has backed by also science. So the benefit to the immune system of positive emotion, including those generated by sacred scripture, for example, and activities that I mentioned before, also backed by large and growing volume of objective scientific research. So for many, religious faith is an important resource for health and well-being, one whose effects should not be underestimated. So this is why we have to work together on this. And now, before finishing this presentation, I would like to show how actually we can remain healthy, but at the same time also resilient during COVID-19. First, what we have to do is deepen our religious faith. And this is a wonderful time to develop our stronger relationship with the God by concentrating on personal religious activities. Maybe before, in the normal time, maybe we have been too busy. So we have no time for spiritual matter. And now maybe this time, we have a lot of time for activities that will help build spiritual health. I'll give you an example here in practical application for a physician. One of physician, for example, when treating a religious patient with panic attack due to fear of coronavirus, he prescribed clonazepam 3 times a day. But what he did, besides that, with that prescription, he said he instructed the patient to read Psalm 91 out loud immediately after taking this, clonazepam each dose. So I think this is the application. That's why I said that we have to, come back to our spiritual, resources. The second one is, there is a saying, love your neighbor as love yourself. When you do not obey your government to stay like, physical distancing, for example, or using masks, actually you are not loving your neighbor as yourself. In all this, in every religion, I think there is a lot of resources that we can have, how we love our neighbor as ourselves. The other one, this is also the problem. There is an issue that Dr. Aziz also told me because of our reckless. Because maybe patient is really reckless, they don't they don't care, they don't want to be to open the truth, to say the truth. So that's also the response, is that the doctor also don't want to treat them. I think in this dangerous time that we live, and in a cavalier attitude is not an attitude of faith. So reckless is not an attitude of faith. No faith tradition condones recklessness. Reckless also means not following the simple step that can help to prevent the spread of coronavirus. So if we also don't obey our government, so that's also a kind of reckless character or attitude. The other one is, what we can do is pay attention to physical health. I think all of you know about that: exercise, sleep, control weight, vitamin D, and other. But then stay spiritually healthy. Develop and nurture a close relationship with God. I think this is time. And maybe we can have also volunteer to help family, friend, coworker, and anyone else in need. This will enhance physical health and resistance to infection, while also spreading God love to others. Many systematic scientific studies have also reported a positive association between religious involvement and an indicator of healthy immune function. I think that's already in literature. So the last one, health literacy. Why there are so many people, as I mentioned before, there are people attitude of reckless. They don't want to follow the government. I think this is also, beside religious literacy, there is also kind of what we call health illiteracy. According to research, even in the United States, it seems like that health literacy remains problematic for the vast majority of people. In the United States, according to a national assessment health literacy, they report only 12% of population have adequate health literacy level. So opportunities exist for healthcare professionals to change community health outcome by addressing this important issue. I think this is what we can do together. Examine the active role of faith-based organization in health promotion and impact on health outcome. We can do that together, I think. Identify opportunities for nurses and other healthcare providers to support culturally congruent and spiritually connected healthcare. Evaluation of available health literacy assessment tool and appropriateness for community health literacy assessment. So I think this is what we can do. Thank you.
Thank you very much, Professor Safa. That's very interesting presentation, and what's the thing that I note here is that this in pandemic time, that's it is time to deepen our faith, and it is a way for us to be more resilient and to get the more spiritual and physical health. And now I will pass this to Professor Javadi for the next presentation, please.
Yeah. Hello. Do you have my voice?
Yes.
Yes.
Good.
Okay. Bismillah ar-Rahman ar-Rahim. Can I share my screen?
Yes.
Yes. Okay. Bismillah ar-Rahman ar-Rahim. Excellencies, ladies and gentlemen, in the beginning, I would like to sincerely appreciate the global community of doctors, nurses, and medical staff and their beloved families who have paid a big price during this pandemic by sacrificing their lives, health, and happiness for the sake of a world free from the pandemic. The topic of resource allocation in bioethics is very broad one, and I only refer to some general points to illustrate the role of religion in this regard. Conflicts of moral judgments are of two types. On the one hand, there might be conflict between two distinct moral judgments. For example, there is a moral judgment to the effect that I shall not assist in murdering an innocent person, and there is another moral judgment to the effect that I shall not lie. There are cases of dilemma as to which of the two judgments to comply with. On the other hand, there might be conflicts between different instances of the same judgment. For instance, as a physician, I have a moral responsibility to save the lives of two patients, but I might be compelled to choose only one of them due to limited time or paucity of available facilities. During outbreaks of epidemics such as COVID-19, conflicts might frequently arise in helping this or that patient. Not much has been said so far about making moral decisions when confronting such conflicts. Undoubtedly, it is of utmost moral value to save even one life. This is the verse of the Noble Quran. من قتل نفسا بغير نفس أو فساد في الأرض فكأنما قتل الناس جميعا ومن أحياها فكأنما أحيا الناس جميعا. Whoever kills a soul unless for a soul or for corruption done in the land, it is as if he had slain mankind entirely. And whoever saves one, it is as if he had saved mankind entirely. If a physician saves one patient, it will be as if he had saved the whole mankind. We see the summit of dignity for a person in this verse, because his life considered as the life of all human beings. We can learn from this verse that in principle there is no difference between the lives of this or that patient. All lives are respectable, and if there is no limit, every physician is morally responsible for the treatment of patients, irrespective of who the patients are. This general moral and religious requirement, which is also grounded in professional commitments of a physician, makes it difficult for physicians to make moral decisions in times of disease outbreaks. Depending on a physician's moral theory, a host of scenarios can be imagined. By moral theory, I mean the criteria of moral goodness and rightness or moral normativity. First, the moral theory adopted by the physician is utilitarianism. Utilitarianism is the most important teleological approach to moral normativity in the modern world. In short, utilitarianism places moral worth in those actions which maximize the happiness of the greatest number of the people. So, according to this theory, resource allocation in health should be based on cost-effective consideration. Limited resource for health should be allocated to maximize the health benefits for the largest portion of the population served. Second, the moral theory endorsed by the physician is deontology. Deontological ethics holds that it may be our duty to perform or refrain from performing certain actions irrespective of the consequences. According to this theory, what matters is the patient should be prioritized in terms of respect for moral duties and in particular justice. The allocation should be equitable or just. Equity is concerned with the distribution of benefits and costs to distinct individuals or groups. There is no generally accepted methodology for determining how equitable a distribution is. Nevertheless, allocations are unsatisfactory if equity considerations are ignored. Third, if the physician accepts virtue ethics, then she can discharge her moral commitment provided that she chooses the patient's out of motives that originate from her virtues, such as compassion, wisdom, full awareness and impartiality, courage and chastity. Now, we come to explore the contribution of religion and its teachings in helping the physician to keep people safe from COVID-19 and to properly choose the patient to be treated in cases of paucity of physical resources or limited time. There is a moral obligation in Islamic ethics to respect medicine and medical practitioners because they are committed to saving patients' lives, which is a main purpose of Sharia. Islamic law or Sharia has some important purpose, one of them is saving the lives of people. For this reason, we see that in the encounter with COVID-19, all religious leaders in Iran clearly stated that people must follow medical instructions and that it is a sin to transgress them. There is no doubt that Islamic doctrines attach importance to one's intentions and character traits. Choices of medical examination and treatment that spring from bad intentions, such as self-interest, resentment, and the like, are incompatible with the physician's moral commitments. This is the great lesson we have learned from great physicians in Islamic history, such as Zakaria al-Razi and Avicenna, that a true physician must be a wise man or hakim, where wisdom is the quality of having experience, knowledge, and good judgment that are free from wild and uncultivated feelings. Love, kindness, and compassion for mankind should be the main motives of moral decisions. A faithful physician sees this kindness and compassion as a manifestation of piety and fear of God. And in treating and caring for a patient, he sees the love for human life as an instance of respecting God and practicing his commands. For him, to treat a patient is to worship God. Now, if such a faithful physician with the good motives and intentions decides to treat a particular patient, she will be rational and impartial, even if she spends her time and medical resources for the treatment of a patient who is more likely to be cured or whose cure will lead to saving other lives. So, for example, when the patient is him or herself a physician, and so on. These possible grounds of preferences are rational, but should be examined very carefully and should be balanced with the other moral duties. The rational process in these cases should not be abstract. Instead, it should be based on past experiences of physicians and on common sense. On this account, I propose that a webinar or an otherwise online forum be organized where physicians can share their precious experiences of encounters with COVID-19 patients so as to open the path to rational and impartial decision-making for younger physicians and to pave the way to the examination of future experiences. Last but not least, we should appreciate medical practitioners. They have stood the test of morality in their treatment of patients. They have performed their duties and have saved people's lives from the epidemic. For those of us who are relatively wealthy, we especially have a duty to keep people from death, not only by medical efforts, but by charity and saving the patients from poverty and hunger in all corners of the world. Thank you for your attention.
Thank you very much, Professor Javadi, for the very interesting question. And we have now about 3 questions here. 2 questions and 1 comment. One comment from Tala Salal. She or no, I don't know, she or he comments about so many aspects of public autonomy that should be compromised for the rest of the good of community during this pandemics. What do you think? Would you like to comment further about this? Maybe Professor Safa?
What is the question again?
There is no question, but it is a comment from Tala Salal about said that so many aspects of public autonomy that should be compromised with for the rest of a good community during the crisis. What do you think about this? Would you like to comment about this further?
Public autonomy, you mean in Iran or in Indonesia?
She doesn't mention about Iran, whether Iran or Indonesia. Or maybe you can explore.
Yeah, I think the what is it, the situation in Indonesia and Iran is totally different, because in Iran, for example, they have what we call mullah. That's actually my question also to the presenter. Do people obeying mullah because he's very high? He has very high position.
بهبود و مسالمه خودمون چیه؟ اون جامعه اصلی اینا. حالا ما بهترین چیش اینه که رهبران دینی ما تو گفتن که گناهه، یا مثلا اگر شما رعایت نکنین حداقلش اینه.
I don't know. I reply or just
Professor Javadi, would you please give time for Professor Safa first to comment on the comments that's given?
Yeah, I think, for example, like here, religious authority is not as powerful as religious authority in Iran. For example, like mullah, when mullah says something, maybe like in Catholic tradition, we have a pope. So when pope says something, all Catholic should obey that. All Catholic in the world should obey that. But in Indonesia, we don't have such kind of authority for religious, religious authority. Because we have a lot of religious also organization. And I think this is what I also presented in Iran when I said that Islam is not a monolithic, Islam is a poly-interpretable religion. So we have no one sole criteria for the authority, for Islamic authority. But in Iran, I think it is different. Because I think mullah is above the president. So as far as I know, everything that governments have to decide, that should be in approval from the mullah. So the they call I call it mullah. So I think that's the difference. So the comment is in Indonesia we might have that we might compromising the problem with all this authority, but for religious authority we may have that, but in Iran maybe they can also compromise. But for example, like what Professor mentioned about that, it is sin if you do that. We didn't like, what is that, coming to that kind of conclusion. Oh, it is sin if you don't obey this, it is sin for you. So that, we just like, what is it, the approach is really different maybe, but they have that kind of authority. So that's the difference, I think, that we can share with this discussion. So I think that what can I say.
Okay, thank you so much, Professor Safa, and maybe Professor Javadi will give a further comment on this, or no?
Yes, yes. There is some difference between religious authority in Iran and in Indonesia, yes. But in Iran also, religious authority is not a sort of blind imitation, because people accept, or we accept the command of, for example, religious leader, but not are based on arbitrary choices of that person, because we understand, or we see that command, or that prescription is based on sound understanding of religious texts. So we come to the understanding or good understanding of the text. If I personally have a good road and good way to have sound understanding of text, so it is not the time of imitation or following some person. So, but if I accept the authority of leader or religious leader, it's based on his understanding of the text, not his arbitrary choices. So religious authority in Iran also finally come to the understanding, sound understanding of text, and can be criticized, and so it is not a sort of arbitrary choice.
Yeah, thank you, Professor Javadi. And Tara also give a further comment. Tara Salal also give a further comment about this, and he said that the religious is a practice that individuals consider as part of their autonomy. So it is kind of like, perhaps in his comment is that this is not about the highest authority that can manage the autonomy of the individual. But let us leave this question and then move to another question given by Galuh Dia. The question is in a chat room. So I will read this question. The stigmatization not just occurs to the patient with positive COVID-19, but also to the patient who recover from the virus. I read news in the pesantren or Islamic boarding school in South Sulawesi. They treat the healed patient like a hero. They meet parade for the healed patient. It shows the importance of religious institution in this pandemic. My question to Prof. Safa and Prof. Mohsen: how to enhance the function of religious institution in this pandemic? Would you like to answer that question?
First, Professor Safa.
Go ahead, Prof. You can go first.
Yeah. Can I answer?
Yes.
Can I answer? Yes.
Yes.
Yeah. I think it is not, our task to enhance religious, the function of religious institution, because it depends on the acceptance of the people. So if people in some country accept the authority of religious institutions, so they have function, they have good function, and but if we want to enhance the function of religious institution, we must come to, make people more religious. It is not our, official task to enhance the function of religious institution. It must be already, founded in them. Not, it depends on our working for enhancing function of religious institution. I mean that it depends on the society. If society accepts the authority of religion or religious institution, so they have good function, they have, enhanced function, and it is not a sort of making arbitrary decisions in this regard.
Yeah, in the Iranian context, Galu asked further whether is there any spiritual services for inpatient with COVID-19 in Iran?
So in Iran, because of confidence of the people to religious institutions, they mainly accept, yes, we have some malfunctions of religious institutions in some cases, or some religious persons. Yes, we have also this sort of issue, this problem, but mainly religious institutions in Iran, based on their good understanding of the role of physicians in treating the COVID-19, so they accepted and they enhanced the role of physicians. So I mean that religious institutions in Iran already have the good function in this regard. And so if we want to enhance them, we must make people more aware of this function of this situation.
Okay, thank you, Professor Javadi. And Professor Safa, would you like to give a comment?
Okay, about the enhancing the role of religious institution, right?
Yeah.
So in my perspective, people understanding about religion is not the same. You can use level. There are level in understanding that about a religion. What is that perspective about religious understanding? So, for example, it was before religion. All religion are local. But then the first level, like prehistoric level, we call it's local. So people use Arabic, or like geographically it is local. But then after that, people created, like from that resources, from that what we call maybe wahyu, they interpret that. So it's become fiqh, for example. And then, but sometimes people don't want fiqh, they still be in the local level, in the first level. But people can move also in the second level. And then there is a third level, people begin criticizing each other. So for example, because they learn from others, they learn from a different, subject, not only religion. So it's coming into the third level. But then the fourth level, I think this is the most, advanced, is the global level. So people like learning from other resources and experiencing something in this life. So they, for example, like this, let me give a simple example. My son, he is in Finland. When he was in Finland, he called me, Mom, it is Ramadan. So Mom, how could I, fast in in Finland? Should I follow Indonesian fiqh, or I have another choice? Because Indonesian fiqh, min tulu il fajri ila, from like sunrise, before sunrise until sunset. But during summer in Finland, sunrise almost from 4 o'clock, and then sunset is almost like 10 o'clock. So it's too long for him. So should I use this Indonesian fiqh? So this is in the global level. We have to consider this because we move everywhere. So religion have become a global. So we cannot use fiqh, Indonesian fiqh anymore. So that's an example. So in this kind of condition, I mean in the condition of COVID, because people understanding of religion is not the same. So I think, yes, we can enhance this role of institution. We what we call in my presentation religious literacy. So mahlan, what is that? Little by little, we have to also to teach, because people also sometimes also getting clever and clever. So we need also religious leader much cleverer than the people. So that's why we can enhance this role of religious institution I think you also already also give an example how we also collaborate between religious institution and medical faculty by creating, for example, like curriculum on how pesantren prevent coronavirus spreading, something like that. So this kind of stuff that we can do. Thank you.
Okay, thank you very much, Professor Safa. I hope that question can answer. That comment can answer the question, Mbak Galuh. There is another question from Arlina Widayati. The question is, how is the social context in Iran? Is it the same with Indonesia that sees misery, including illness, as punishment from God? Professor Javadi or maybe Professor Safa may give the answer, please.
Yes, there are some people think like this. Yes, they take some illness or every misery as a punishment from God, but it is not common in the population. Most of us think that. We have narrations. Yes, you are right. We have narrations from the Prophet or from religious narrations. Sometimes illness or misery is a sort of punishment for a person. In principle, this is okay, but we cannot say that in this case or for this person, this illness is a punishment, because some cases or most of the cases of illness is for cultivating people, or in Arabic we say that al-balal al-bala. It means that some cases God wants a person to cultivate or to make him in higher level. So in some illness or other miseries come for him. So it is not in all cases the same. So because we do not, which case is a sort of punishment for that person or is a cultivation for that person, we cannot come to the persons or each person say that this is a punishment. Originally or in principle, we accept in some cases, according to our narrations, some cases of illness or some cases of miseries or other unfortunateness is a sort of punishment, but we cannot do and we cannot say something about these people or that this person or that person. It is due to God's knowledge. So my answer is that yes, in some cases people accept this idea, but it is not correct. It is not in accordance with religious teachings.
Yeah, okay.
This is the answer.
Thank you very much, Professor Javadi. And there is also further question related to that. The question is from Dr. Yadola Zarezadeh. So the question is, in this condition of COVID-19, we are now facing various dimensions where there is a need. First, in one hand, we have to consider safety and saving lives. On the other hand, we need whether to compromise this kind of religious ritual and ceremonies in our lives. So how do you see both of these? Maybe Professor Javadi or Professor Safa may give the answer, please.
Yes. Professor Safa is giving.
Yeah.
Okay.
My answer is that there are.
Go ahead, Prof.
Can I start my answer? Or?
Yeah.
Go ahead.
Go ahead, Professor Javadi.
Yes, yes, yes. There are conflict of duties in ethics, in Islamic ethics. Saving people is more important than any other moral requirements. So, or religious requirements. Yes, prayer or other ceremonies is important in Islamic society, but most important is saving people, people's life. So, in conflict between taking time or giving opportunity for saving the life of people, it is important than doing anything in ceremonies or in religious worship and any other activities.
Okay.
There is a conflict of duties, so we need to give what is the important more, attention than other moral or religious requirements. According to Islamic teachings, the life is more important than any other thing. There are some cases we must give our life, for example, for the sake of religion, for the sake of jihad or other things in some cases, but it is not in the case of conflict between worship or religious ceremonies in the mosque and saving the life. So saving the life is more important than other.
Okay, thank you very much, Professor Javadi. I hope that's answered the question. And also, there is one very interesting question from Dr. Hamid Reza Namazi. The question is that he said, I had a question. I think resolving some of this question requires consideration beyond bioethics. It seems that we need to define biopolitics in the Islamic world. What do the professors think about this?
This is difficult question because there is a sort of conflict in some cases between Islamic jurisprudence and the common sense morality or rational ethics. So we need to some discussion in detail to make or to find the possible solution for making coherency between Islamic jurisprudence and Islamic ethics. So I think we don't need to go beyond Islamic ethics because we can find some way for making coherency between Islamic ethics and Islamic jurisprudence. So we don't need to go beyond Islamic ethics or rational ethics, according to my understanding. But it is a difficult question and need more time to be discussed.
Yeah, okay, thank you. Maybe Prof. Safa would like to add more about this question about looking at this kind of practice or ritual to broader than just Islamic religions, but also about the biopolitics in the Islamic world, and how do we address this kind of pandemic situation through the broader view.
Okay, I would like to answer the question before. I think about the perspective that illness is a kind like punishment. Maybe some people have that kind of perspective, but I myself will not agree with that because if it is punishment, especially in this kind of condition like COVID-19, it is, this COVID-19, actually the patient is not just people who have a lot of sin or something like that if it is a punishment, because there are innocent people also who have this kind of a virus. So maybe at least we can say maybe it is a kind like test or something like that. So it's not a punishment. I think we will question about the justice of the role of the concept of justice in the God perspective. So I think I will not agree about that. And in the COVID-19, which was many dimensions, there is a need for considering safety and not commerce. I think actually we still can compromise because the prohibition is not that you cannot worship there, or prohibition is not about worshiping, but the prohibition is you cannot like public community that a lot of people coming together, but you have to have like self-distancing. So it's still such kind of a ritual or ceremonies, but maintain the protocol. using what is that, a mask, and also like maybe at least 1 meter, what is it, between each other. So something like that, we can compromise that actually. So
Okay.
Still can do that.
Okay. Okay. Thank you very much, Prof. Safa, for your comments and answer. And sorry, because we have to end up this interesting question because we ran out of the time. So I would like to thank you for the distinguished speakers for these discussions, very fruitful discussion. And we have a lot of questions actually, but we have no time. And thank you so much again. I hope you have enjoyed the seminar, and I will pass this to Puspa again. Thank you so much, everyone.
All right, thank you so much, Bu Adeline, and everyone. That wraps up our webinar series for the day. Thank you very, very much for the guest speakers and all participants for sticking through to the end of this webinar series. Thank you also to INA Health TV and Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada for facilitating this webinar. Before we end the webinar, please be informed that all the slides from the speakers will be compiled and uploaded on this page. We have posted the link on the chat box. Please kindly check it out. It also contains information on how to claim your certificate. You can find it under the Housekeeping tab. A recorded version of this webinar will also be available on INA Health TV YouTube channel, as well as CPMH's website. Once again, thank you very much for your attention and participation. The series is far from ending, so stay tuned for more interesting and thought-provoking webinars in the next future. Stay healthy, keep practicing good hygiene and physical distancing, and may you have a great day ahead. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon.
Thank you, everyone. Bye.